Today's morning medicine is Bovista, which is the warded puffball. And as you can see, it's got little warts on it. I've seen puffballs, well, I picked puffballs like this out there and ate them. So I don't know if it was the same one, but yeah, they were decent. And any puffball you do pick and want to eat, they got to be white all the way through. If they're not, they are ready to spore, and that's not good for you. So, Bovista, the warded puffball. Great hemorrhage remedy and all that kind of stuff. Let's see. So the folklore, Clark states that globular fungus, which according to report is eaten in Italy. Okay, so that one may not be around here. Before it is ripe, becomes filled while ripening with black dust. Yeah, and that's what and that breaks the husk. So this black dust breaks the husk, and you'll see that in uh, the puff balls. They more or less, the ones around here, they look green. This one looks black, and it breaks the husk, so it puffs it up to where it breaks open, which contains it with a slight noise. Okay, so it'll pop open. So that is a signature of this medicine because people become puffy and they don't break open, but they become puffy, corresponding to this signature. And the doctrine of signatures, that is a thing where you're basically looking at like hawthorn berries. They almost look like a heart. There's walnuts. They look like a brain, and they're good for the brain. So that's what the doctrine of signatures are. They look at something and wow, this, has the red root. You cut the root of I forget which plant it is, but it looks like it bleeds. Red stuff comes out. Good for blood. So those are the doctrines of signature. Bloated, puffy condition of body surface. So they're bloated and puffy, just like that puffball puffball gets. Um, and a sense of enlargement. So it feels like everything's just enlarged in their body because it's getting so puffy. Flatulent distension and noisy passage of flatus are leading features of Bovista pathogenesis. So the pathogen or the sickness or the disease is they get bloated, they have a lot of gas and very noisy gas. So yeah, and a sense of enlargement everywhere. We may always think of Bovista when we see a very tettery person. Tettery meaning they've either got eczema or they've got warts or they've got something like that skin stuff going on. One who has tetters here and there all over the body. These tetters may be either moist or dry. So it can be in a herpes, it could be a lot of different things. Not the sexual disease so much as herpes, but herpes simplex. M.L. Sirkar, a doctor or homeopath, has recorded a striking cure of such a case with Bovista 3X, the pain being gripping, twisting, intermittent, starting below umbilicus. So it starts below the navel and diffusing itself towards the epigastrum, which is the side of the lower abdomen. Some constipation, urine is scanty and reddish. So they got red sediment in their urine. Nothing gave relief except eating. So unless they eat, they got all this bloating and this stuff going on. Itching at top of coccyx. That's a very big keynote of this one. Their top of their tailbone, they just have all this itching going on. Is another characteristic symptom. Okay, Bovista has cured cases of ovarian cysts. So any woman having cysts, this could be an indicated remedy. And also warts, Duja, a few other ones for that. Corns with shooting pains. So constitution hemorrhagic diathesis, which is just they bleed from different orifices. Adapted to stammering children. So any child that has a stammering problem. Old maids with palpitations of the heart and tettery skin or like eczema and stuff all over the skin. So let's get into Bovista puffball. Circulation, very good for the circulation. Hemorrhagic diathesis, which is bleeding from different orifices. These are both three. So very affects the circulation and the bleeding, the blood basically in the veins and everything. Ovarian cysts, warts, and corns. Better bending double. So they want to bend over, because their stomach's hurting so much, they want to bend over towards their knees. Hot food makes it better. Eating makes it better. It's worse. Menses. Now, I think this is during menses. And hot weather. Uh, Antidotes, charcoal fume effect. So someone's having a fire, they're in their house and they're using coal. They used to use coal. Anybody doing that and they get asphyxiated from the fumes. Bovista would be one. Carbo-veg would be another. There's a few of them. Um, let's see. Worse, cold food and getting warm. Oh, that's all in the modalities. I missed that. Sorry. So worse menses, hot weather, worse cold food, and getting warm. They want hot food, and they don't like getting warm and hot weather, so they like the cool air more. Stammering, uh, when they try to speak, stramonium and mercury has that. What the heck? Someone's at my door. One of the cats. Stramonium and mercury has, with the stammering. You look up stammering. Someone is stuttering. Then you'd have stramonium, mercury, bovista. There are probably a few other ones, but those are the top ones you would consider with someone who stammers. And this can come from. Um, I know Tony Robbins talked about helping a fellow that was stammering, and he did it. I think his parents always fought or something, and he would watch Bullwinkle, and Bullwinkle would stutter, and he used that, and that they focused on him for the stuttering and to stop the fighting. So that was something in his whole life. So he took him back in his childhood to that time, came out, and basically was, he got over that stammering. So it can come from a lot of different things. It can be a medical situation that Bovista, stramonium, and mercury can take care of, but it can be just from situations in their life. Everything falls from hand, so they try to grip something and they can't hold on to it. And that's most likely in older adults and stuff, but it can be in the younger people. Enlarged sensation, and so it feels like the head's enlarged, the body's enlarged, whatever's enlarged. Argent Night and Bovista have those symptoms. Those are two of them you'd be considering as a medicine. Colic. That's a 3 with bright red urine. So I thought it was just sediment in the urine, but it's obviously the urine's bright red. So this has got to do with the blood and the hemorrhagic diathesis miasm that they have. Relieved by eating. So that colic's relieved by eating. That's a 3. Colic's a 3. Relieved by eating is a 3. So that's why they want to eat to relieve that pain that they're having. Pain with heaviness after stooping. Interesting. So they stoop over and they get this pain and heaviness in the back. Itching of coccyx. And that's another thing with stooping. People go to pick something up and they bend at the waist. And that is so horrible for your back. You always want to engage the what is it? The thighs, anyways. You want to engage the thighs and pick up that way. If you don't, then I used to have to pick up I don't know how much it weighed, probably 150 or something pound um, floor buffer, and maybe carry it upstairs in that, or carry it wherever I was going. And I would always bend over at my knees, and I would grab it, get it to my trunk, pull it into me, and then stand up. If you didn't, that's why a lot of people get back problems. No chest, boil in the right ear, pain, worse swallowing. So they've got fetid pus. So they've got odor, no doubt an infection in the ear here, but that boil in the right ear is can be all part of this. Hearing is indistinct. They misunderstand much that is spoken. So this boil and this, it's probably otorrhea, but it's fetid pus coming out of the ear. So they got an infection, a boil, that they can't understand people's hearing because of this thing. And Bovista could be an indicated remedy for that. Objects seem nearer, so the objects that they're looking at seem real close to them. Loss of vision from paralysis of optic nerve. So this could be good for, I want to say blind people, but if someone loses their vision and the optic nerve is the problem, Bovista could be considered for that. Acne, That's a 3. Worse in the summer. So their acne comes on in the summer. It's worse, but they do have it throughout. But usually it's worse in the summer. Cheeks and lips are swollen. There's that swelling again. Twitching before asthma. So their face would twitch before they have an asthma attack. Female, diarrhea before and during menses. So before their menses come on, they start having diarrhea and they last throughout the menses. That's a 3 for the females. Bovista. Menses worse at night. So, and that night is a 3. So their menses are worse during the night, which is kind of unusual. Usually menses just come on when they come on, but this one's worse at night. Cannot bear tight clothing around waist. Lachesis has that. They can't bear tight clothing around the neck. Lachesis person that needs lachesis, but they can't, Bovista, they can't bear tight clothing around the waist. Traces of menses between menstruation. So they have a little bleeding between their menstruation. This is all a 3 for the female. No food. Tension, headache. So what's a tension headache? It, just, yeah. I mean, that's kind of self-explanatory, I'd imagine. That's a 3. Sensation as though head is enlarged. So there's that enlargement again. That's a 3, especially the occiput. And the scalp itches, and they say it itches so bad that until it bleeds. Worse, warmth, any warmth, their scalp itching, that it makes it worse. And that's like a sulfur situation. Could be serinum. Any warmth causes the itching to be worse, whether it's the head or the body or whatever. But Bovista is the scalp itches and it's worse warmth, and I think it says till it bleeds. Visible palpitation of old maids. So the heart has uh, palpitations of older ladies with trembling of hands. So the hands tremble and they have palpitations of the heart. Worse, bathing and excitement. So they can't handle any excitement because they will have more palpitations, more trembling, and they don't like bathing for whatever reason. Probably the skin situation, I would imagine, but it's saying the trembling and all that is worse bathing. Frequent desire to urinate even after they urinate. So that's tenesmus is what they call it. And that's in diabetes mellitus. So they urinate and they don't feel like they're done. They get up, they leave, and oh man, I feel like I got to urinate still. So that is what they call tenesmus, which is never feels like you're finished or complete. Great weakness of all joints. All joints are weak. They have an onion smell coming out of their, and it's probably not just from eating onions, but they have an onion smell coming out when they sweat. Typicoxis, and this is a 3, itches intolerably. So they can't handle it itches so bad above their coccyx for whatever reason. Bovista would be considered. Edematous swelling of right foot. So that's, edematous is fluid swelling of right foot years after a sprain. So they have a sprain in their earlier days, and now they still have this swelling of the right foot. And it's right. It doesn't have to be right, but it's they're saying it's more likely right. And this is a um, um, retaining of fluid that causes the foot to swell, and that's years after they have sprained their foot, I guess their ankle, I don't know. No liver, shortness of breath on moving arms. So anytime they move their arms, they have a hard time breathing. Viscid expectoration, which is just a lot of expectoration. Spasmodic, laughing and crying with asthma. Uh, yeah. So anyways, they laugh, they cry, they laugh, they cry. It alternates, and that's with the asthma when the asthma comes on. And that can be with that asthma can be the shortness of breath there. They've obviously got a lung condition there that Bovista could help. After sex, reeling and confusion in head. So they just reeling is like a vertigo almost in the head after sex. Sex desire is increased in the male. Bovista would be considered. Discharge is stringy from the nose, is stringy. That's a 3. It's tough. So Cali Bic, that reminds me of Cali Bic if it's yellow. I don't see yellow though. Cali, there's a few of them. Hepar sulf, a couple of them. But Cali Bic is really the stringy, tough mucus from the nose and the lungs and the mouth and all that. Stopped up, cannot breathe. So the nose, they can't breathe through it. Bleeds during sleep, especially, but their nose is constantly bleeding. There's a lot of bleeding. That's what that circulation, that hemorrhagic diathesis miasm that they have. Itching in anus. So the anus is itching, the coccyx is itching, and they have stitches in the perineum down there toward the rectum and genitals. So this stitching pain, this sharp pain is what it is. From the perineum to the rectum to the genitals. Chronic diarrhea in the elderly, this could be very helpful for. Urticaria on excitement with rheumatic lameness. So skin stuff, that's why I always say a lot of skin stuff is related to rheumatic or joint pains, joint stuff, and a lot of skin stuff is related to asthma stuff, so if we're taking care of urticaria, should be an R, urticaria on your skin, the rheumatic joints will get worse and the asthma will get worse. If you clear up both of those situations, the asthma, and this person that needs Bovista has both of them. Sometimes it's one or the other. This one seems to have both asthma and rheumatic stuff along with the skin stuff. You clear up the skin stuff, the rheumatic stuff will clear up and the asthma will clear up because the skin stuff is external. It's the body trying to push out this rheumatic problem and this asthma problem. And once you clear up the skin stuff using something like Bovista, then you continue it, the rheumatic and the asthma. I don't know which one will go first. Um, Hard to say. I imagine the asthma first because that's seems more surface, and the rheumatic is more in the joints. So that would be a little deeper, it seems to me. I don't know. It would depend. And you could clear up the skin stuff with Bovista and then need something like maybe Rus tox for the rheumatic, maybe arsenicum for the asthma, something to that effect. But they have a lameness from this rheumatic stuff and the skin stuff. The urticaria covers the whole body, worse bathing. I thought so. That's why they don't want to bathe, because of the skin stuff. Jaundice in newborns, any newborns having yellow skin, jaundice from the liver stuff. Itching on getting warm. So that's why I say sulfur, serenum, a few other ones along with Bovista. And the one fellow says that Bovista, I think it's Clark, says Bovista he puts in with the sulfur patients. And sulfur has a whole, you know, thing there with the skin and stuff. Palpitations and diarrhea. Where's that at? Yeah, well, it should be in the rectum, but it's, them palpitations of the heart and the diarrhea. For some reason, it's here. I guess, you can put it in the heart, you can put it in the rectum, but he's got it in the skin. Palpitations and diarrhea. So obviously, it must be related somehow to these skin problems. Dulcamara and Bovista would be for them palpitations with diarrhea. Okay, intolerable to tight clothing around the stomach, around the waist. Nausea, better in breakfast. So they wake up, they're nauseous, they eat, they feel fine. Vomits watery fluid. So there's no color to it, it's just more watery. Sensation of a lump of ice in the stomach. And the temperature, they have chill with their pains. Okay, I'm going to try. I had a hard time understanding um, the one of these cases. So let's get into it. Let's relax here. Yeah, there you go. You can see the rest of my room. There's my clothes and all my books, and I got more books there, and that's why my wife kicked me out of my room. I got books over here, books over there. I got books everywhere, and I got medicines all over the place, and computers, and yeah, we got our separate rooms years ago. Plus, she wanted to sleep in a waterbed that she had heated with a electric blanket on, with another blanket on top, and then lay on me. And oh man, I was like, I can't sleep like this. I slept on a floor in a sleeping bag for a few years. Finally, we got a place where we got our separate rooms. She could be as hot as she want. I slept with the window open last night. It was 38, I think. A little chilly, but I gotta watch, because if I lay on my belly and that's on my back, I woke up with a stiff back the one morning. So which I can homeopathically take care of, but I just got up and moved. There are ebulations with great thirst. I think, what was ebulations again? I forget. Anyways, the corners of the mouth are broken out, so that's herpes, basically. Numb, pithy feeling in mouth. I don't know. I ain't not going to get into what that is. There is stuttering and stammering speech, awkwardness, misapplies words in speaking and writing. So they're having confusion with, not only are they stammering or stuttering, they are basically having problem, putting, they're misspelling words, they're using the wrong words. Relaxation of an entire capillary system. That's that hemorrhagic diathesis. Hemorrhage from menstrual irregularities or from trauma. So they can be trauma or they can be menstrual irregularities. They have hemorrhages. Menstrual flow occurring only or chiefly at night. That's got to be a problem for a woman. Hemorrhage between the periods. So they will have bleeding between the periods. The puffy expanding properties of the remedy are shown in a puffy condition of the body, surface instruments. I don't know, scissors. Oh, any instruments indent the fingers in an unusual degree. So you push on the finger with something, you put it on a desk and you push, it'll indent it really very oddly compared to most people. So if you had a person come into you, you push on their finger and it really indents, you would consider Bovista. But a lot of bleeding, a lot of puffiness, and that's that enlargement and all that stuff. The heart feels enormously large. There's the enlargement again. Bovista has colic, like cholesynthesis. Cholesynthesis would be considered with Bovista with the colic, causing the patient to bend double. But it differs from cholesynthesis in that the colic is better by eating. So cholesynthesis, they both bend double, but the colic in Bovista is better by eating and is sometimes accompanied by voiding of red urine. So the urine be red. That reminds me of some blood down there. A case of a cyst in a broad ligament was cured with these symptoms. So a cyst on a ligament, not so much in the vagina or anything, but on any ligament. Metrorrhagia, flow at night or early morning, easily provoked from slight overexertion during menses. So if the metrorrhagia is bleeding, it brings it on by doing any kind of activity. Overexertion, basically, not any activity, but when they overexert themselves during menses. Can bear nothing tight around body. Menses preceded and followed by diarrhea. Oh, so the diarrhea is before menses, during menses, and after menses. That's got to be a problem. Let's see. Acrid corrosive leukorrhea. So the leukorrhea is like destroying the tissue down there. Flowing at night only. So there, all this, the menses and the leukorrhea is all flowing at night. Follows menses. So after the menses, they have this leukorrhea that's acrid. It's burning the mucous membranes, and it only flows at night. Testes observed psoric eruptions. Psoric, that's, skin eruptions, basically. That's psoric is a miasm, basically. Appear on the hands and feet of the patient to whom he gave Bovista for his headache. He cured with it a red, crusty eruption on thighs and bends of knees of 18 years. Interesting. So this lady had this red, crusty eruption, and they have it in italics, so this is like a keynote type of thing. On thighs and bends of knees for 18 years, he cured it. Duration: it disappeared for weeks, reappearing in hot weather and at the full moon. The full moon, they always had this thing that the full moon really affects you. And I don't doubt it does. We're 90 or 80 or 90% water, and probably 80% water, and the moon pulls on the water. You know, uh, what's that called? The whatever that is. The It's not magnetism or anything. It's the gravity, I would imagine, of the moon. Anyways, and it pulls on the ocean, so it definitely pulls on us. But this eruption would disappear for weeks, and then reappear when it got hot and there was a full moon. W.S. Gee cured with Bovista 4C after the failure of Rustox. So a skin situation, he used Rustox, didn't work. He gave Bovista 4C. The following case. A widow, and this is the one I don't get. Maybe I'm just reading it wrong. 55 had an eruption, which she thought to be erysipelas, which is a skin thing, on right foot. Some years before, she had an eruption on left foot, which discharged much water and was cured by the use of a salve. So she used the salve to cure the one on the left foot. And that's why I say, this kid, they were irradiating him for cancer in his leg, and it disappeared and then it came back. So there's something in the body that's kind of wanting to throw off these sicknesses that we have. And no matter what you do externally, like she put a salve on her left foot to cure that eruption and that had a discharge, and it went away on the left foot and now it appeared on the right foot. So whatever you're doing externally, or you're drugging it, or you're burning it with a radiation, or whatever you're doing there, that's not the way to do it. There's something internal that the body's trying to throw off. And that's why I said, it can even be emotional stuff, like the guy in India that did a case on Hint. I was on Hint yesterday, and a guy, what did he cure? What did he take care of? He had a real hard time. It was, geez, just did the case yesterday. Uh, Gabriel Tron. Okay, I don't know what it was, but it was a heck of a case. And I love hearing these cases. So this one here, he cured this. It had a salve, and he cured that. It took care of it with the salve. The lady did, and then it came back on the right foot. So he used Bovista 4C for it. A few months later, the left knee became affected and the limb was amputated above the joint. So the present eruption was fiery red. So she had they cut off her leg for this eruption. Not necessary. I listened to a lady, what the heck's her name? Uh, anyway, they're talking about cutting things off, and she's like, "Oh, please don't, or cutting out your appendix. Don't do that. We can take care of that." Um, what is her name? Very good herbalist. The present eruption was fiery red, covered with yellowish brown scales, thick as an old-fashioned wafer. So, okay, so now I'm trying to get this case around my head. She had a left foot eruption. She took care of it with a salve. Came back on the right foot, okay, and he cured that. Then a few months later, the left knee became affected. Now, why she didn't come back and get more homeopathic medicine, or even continue the medicine that the Bovista he gave for the foot, why she wasn't continuing it. When things disappear, I got that lady in Germany. She started taking Kel Carb, and she's, oh yeah, I'm 30% better. You still taking it? No. And why not? That's the whole idea. People don't understand how homeopathic medicine works, and they basically just don't continue. The present eruption was fiery red, so they cut it off, and he did that with Bovista. There were also rheumatic pains in the leg after Rustox had been given without benefit. Dr. Geeks elicited these additional symptoms: occasional spells of short breathing, especially from working with the hands, frequent desire to urinate, even immediately after urinating, sleep disturbed by burning and itching, and also by anxious, frightful dreams, headache when waking from sleep. These symptoms being found under Bovista, in addition to moist vesicular eruptions, was under Bovista, with formation of thick crust, the latter put in heavy type by Lithenthal. This medicine was given with steady improvement and eventual cure. So I don't know why her leg was cut off, but yeah. Early morning sweat, worse on chest. Many symptoms are worse in early morning. The diarrhea occurs, then the sweat of axillae, which is the armpit, smells like onions. Sensitive to touch, cannot bear clothing, sensitive to drafts, chilliness predominates. Okay, I wanted to read something else. Okay, stramonium, laughter alternating with weeping. That's, Bovista has that, and so does stramonium. Arsenicum, lycopodium, and sulfur, immediate sinking sensation immediately after eating. That would be Bovista. Arsenicum, lycopodium, and sulfur would be medicines you consider. Bufo, sensation as if heart in water. Bufo and Bovista would be considered. Zincum, worse from wine, and that's also this one. Cholesynthesis, colic is better, bending double, so you'd consider it. And the difference we showed you earlier. AMC, whatever it is, ammonium carbonicum, I think. Poisoning by charcoal fumes, and I would think even carbo-veg, but Bovista, ammonium carbonicum, and I would think carbo-veg. But anyway, stramonium, stammering, so if someone's stammering, Bovista and stramonium. Ambra, hemorrhage between periods, that would be considered with Bovista, and also sequela and ustalaga. And I just told a lady she had bleeding between her periods and that, and I told her, take ustalaga. Now I got to talk to her again, but it seems like she said it took care of it. It antidotes effects of tar applied locally, so they were putting tar on the skin of stuff. Followed well by aluminum, calcarb, and rustox, and sepia. Testi puts Bovista in his sulfur group, and it's antidoted by camphor. Bovista antidotes coal tar application, suffocation from gas after rustox in chronic urticaria. So you give rustox, doesn't work. You give Bovista for that urticaria. All right, that is morning medicine. You can age, but you don't have to get old. I'm starting on a vitamin regimen. We'll see how that works.